I'm going to be performing a dentistry using a Dental-Air dental unit. This particular unit is very nice because it is a portable unit which has its own compressor and its own water supply. Other parts of this unit which make it a really nice functional unit is that it has a water air mist gun so we can rinse the teeth off as well as apply air to sites so we can look, make sure we're not missing anything during the dentistry. It also has an ultrasonic scaling head. The thing about this particular head is that it has wavelength vibrations that help break any tartar or calculus off the teeth. Other types of units you can see are rotary based where the tip of the head of the scaler spins at a very rapid rate. But this particular unit is ultrasonic, so again, just the vibration alone will help break the tartar off the teeth. The other two parts that we have to this unit is a low speed polishing head. After we scale the teeth, we need to polish to get any of the fine little scratches within the tooth out, and that's the point of the polishing head. And then finally what we have here is the high-speed burr. This is meant actually to cut roots and even burr down roots of teeth, especially if they're very difficult to remove during extracting. During dentistries, we actually have monitoring devices on our patients. The importance of this is that patients can become what we call hypotensive, meaning they can have low blood pressure and they can also have a lower heart rate. So while under anesthetic and while performing a procedure, we have monitors to help assist us. They have alarms on them, so if anything should sound, again, not only just the monitors, yourself as the person doing the procedure can also pick up on any abnormalities that may be occurring. Today, the one piece of equipment that we'll be using is what we call a pulse oximeter. The nice thing about this is that it checks the saturated oxygen level within our patient's bloodstream, more specifically the hemoglobin. And it also checks our patient's heart rate as well. Again, as a concern with any anesthetic, our patient's heart rate can drop, and this can also tell us specifically where their heart rate is at, that if we need to attend to them immediately for whatever reason, the monitors are there to assist us. Finally, another monitor that we're going to be using is a blood pressure machine. This is nice because it gives us the two readings for our blood pressure, systolic and diastolic. Our systolic reading is actually going to tell us the pressure in the arteries when the heart is contracting. And the diastolic is going to give us the reading of the pressure in the arteries when the heart is at rest. During, again, anesthetic, our patients can actually have a low blood pressure, so it's very vital that we are watching them during the time they are anesthetized. There are other different types of monitoring devices that you can use, but today these will be the two that we will be using for our dental procedure, so let's begin. Before I will even get started, I would normally just like to start by cleaning the teeth, but when I have large amounts of plaque and tartar on the teeth, I can end up wearing down the head of my scaler, so you never want to start by scaling this right with your scaler. The instrument that you would want to use, and it's one that is common to use during a dentistry, is called an extractor. An extractor does several things. One, it extracts teeth, but what it also does is it breaks the tartar off of teeth so you don't dull your head of your scaler. As you see, it breaks it right off. And our patient says, yep. Get that tartar right off our teeth. The extractor really cannot go underneath the gum line itself, so that's what your scaler is going to be for, as well as other instruments that you can use, such as something we call a curette. Curettes are actually meant to go underneath the gum line itself so you can actually physically scrape any remaining tartar off the teeth under the gum line without it doing any more damage to the gum line itself. And as you can see, I can actually go in pretty deep. You will hold your scaling head at an angle when you are doing a dentistry. If you hold it too head on, you can burn the enamel off your tooth. You definitely don't want to do that. Even though this is ultrasonic, I'm still going to do a side motion with my hand just to help along the dental itself so this can go by a little bit faster. Again, you don't want to stay too long for a period of time right on one tooth. And when I do scale with this particular head, you will find that water will come out of here, which will help, again, prevent us from burning the enamel of the tooth. In
some cases with older animals, you can find that you may not be able to get their teeth as white as you would like. And what ends up happening at that point is that this is what we would call a staining has occurred. So no matter what you try to do, you will never end up getting that tooth completely clean. What we're going to do now is we're going to rinse. Now at this point, hopefully after performing the dentistry, or at least on this one side doing this cleaning, that this gum itself will start healing itself. The nice thing with, if any animal starts having issues with gingivitis, it can correct itself. When they start having periodontal disease, again, that severe recession, once the gum line is pretty much damaged, it is damaged. Now we're going to apply a medication that I already discussed earlier, the Orvet Plaque Prevention. The tooth has to be dry when you apply this. The main point is that you are providing this extensive barrier of protection from the gum line to the tooth, so we don't get that additional tartar again and plaque underneath the teeth. Unfortunately, there's no rhyme or reason on how to do this the right way, so we usually just take our stick and we just adhere it to the tooth then. Again, just like the paste itself, you can initially just apply it, but the main thing is you want to rub this in well. As soon as you are doing a dentistry itself, within hours, tartar can start forming again. You may not necessarily see it, but it's at work. So you can maintain the teeth at home by doing the same exact thing. You can go home and actually apply this as well yourself on a weekly basis, or you can start polishing the teeth at home by just using a finger brush or a toothbrush and a paste specifically made for animals. You never want to use human toothpaste because it shouldn't be swallowed, and dogs and cats generally don't know that they shouldn't swallow that. My very final step on this is I'm going to end up rinsing the mouth. Normally we like this to dry, but what I'm going to do is I'm actually going to just take a rinse. It's a chlorhexidine rinse. It's going to give a really nice minty smell. The toothpaste itself was a berry flavor. I usually like to rinse off the tongue. And that's the first side of the dentistry.